AIIMS Director Dr. Randeep Guleria has urged citizens to get vaccinated in large numbers in order to beat the COVID virus. This is his address to the media some time back. Let's play that out in interest of public awareness.
The efficacy of vaccines has varied from about 70 to 80% in most of the phase 3 trial for the Covishield vaccine and for Covaxin. It may be higher when you come to field studies. But I think it's important to remember 2 or 3 things. One is that any vaccine is not 100%, even the vaccines available outside. So you will have a small percentage of people who may still get the infection despite being vaccinated. Secondly, we must understand what are we wanting as far as the vaccine is concerned. We are wanting vaccines to save lives. So the vaccine will prevent people from getting severe disease. It will prevent you from getting disease which could kill you, which will make you go into the ICU, or which would damage your lungs. But it will not prevent you to a large extent. It may do to some extent, but not to a large extent, from getting the infection. So you have to understand the difference between infection and disease. You may get the infection, the virus may be there in your nose and throat, and you may be able to spread it to others. But the antibodies in your blood, which have occurred because of the vaccine, will not allow the virus to multiply for a long time and will not allow you to get a severe disease. But the virus may still stay for a short duration in your nose and throat, and you may therefore become RT-PCR positive. You may also give the disease to others. So you may get less disease, you may get a mild disease, or you may be asymptomatic, but you will not have severe disease. So the vaccine prevents you from getting more severe disease. It does not prevent you from infection totally. So we are seeing a huge surge in the number of cases, and this has really gone up exponentially, causing a huge strain on the healthcare system. I think the cause for this is actually multifactorial, but I think the 2 main causes, that one is that in January and February, when the vaccine started being used and cases came down, a lot of people felt that COVID is over and felt that they did not need to have COVID-appropriate behavior. People stopped wearing masks, people started having parties, and there was a lot of get-togethers and marriage functions because of the fact that all of them had been put on hold for a long time, for almost a year. Now the virus was still around, and therefore this gave an opportunity for the virus to spread itself rapidly. I also feel that at that point in time, unfortunately for us, the virus did mutate. A new strain was there in India, which was more infectious. It was able to spread more rapidly among people than what it was doing 6-7 months ago. So therefore, this led to an environment which was very conducive for the virus to spread because there was no COVID-appropriate behavior. The virus could spread rapidly in our community in special areas like we saw in Maharashtra and certain states to a large number of people because of crowding. And this led to a huge surge which happened in a very short span of time. The curve is very steep, suggesting that these 2 factors led to a huge increase in the number of cases in a very few days rather than weeks or months that we had seen last time. So currently, not only are we seeing record-breaking numbers, we're seeing a huge strain in the healthcare system because of if you even say that only 15% of people will require hospital care,